We've got the Republican Congressman Leonard Lance joining us right now. Speaker Ryan is speaking or meeting with the president right now. We might get a sense of where this stands, but, you know, they're going to have this vote today. Congressman, where do you stand with this?
I'm an opponent. I will be voting no today on the bill. I don't think that it lowers premiums, and that's what the American people want. And I think the Democrats should come to the table on this issue. They're, after all, responsible for Obamacare, and so far they've refused to do so.
All right. We were also showing Vice President Pence. He is arriving at the Capitol. I don't know whether the president or the vice president have been trying to, you know, come to terms with you, Congressman. But what do you think of this, I guess, full court press?
I can understand why that is occurring, but I've indicated to the leadership that I am a no on this bill, and I think that we have to move forward on other aspects of what is known as Phase 3. I'd like it to be Phase 1, and that includes purchase of policies across state lines, for example, medical malpractice insurance reform.
So there's no way to get you to budge, right? I mean, when they hear someone like you say, look, I'm not moving on this, do they just give up and say, all right, well, we'll fight another day together, or what?
Of course, leadership would prefer that I be on the other side, but I think they respect my position as I respect their position.
They don't threaten you that your office is going to become the janitor's closet or anything like that?
No, they do not.
Okay, well, that's good to know. You know what I'm wondering? Can the president just say what he said, Congressman? So, you know, this is it, yay or nay today. Then we move on. If it doesn't work, it doesn't work. I move on to tax cuts. Can he do that?
I certainly think that we should be discussing fundamental tax reform. The American people need that. Our business community needs that. That doesn't mean we can't continue to work on this issue, but I do think it will require cooperation from the Democrats, at least to some extent. And I challenge my Democratic colleagues to come to the table, because, after all, they were those who voted for Obamacare initially.
Who do you think is going to get the blame if this goes down? Now, you have very genuine concerns with the cost of this, and some like you have called it Obamacare Light, Obamacare 2.0, taxes remain in place, some restrictions remain in place, and in the end, a lot fewer people will have health insurance, so much ado about what. But what happened? I can't imagine the president taking the fall for this if it happens. But someone is. What do you know?
I think that this town is too much consumed by who's up and who's down, who's right and who's left. And I support Speaker Ryan. I think he's doing an excellent job in a difficult situation.
Do you think he's toast if it falls through, though?
I absolutely do not think that.
Right.
And I think we move forward, for example, on tax reform, as the president has indicated.
Many argue that, in retrospect, the president and Congress weren't working more closely on this, maybe because his election was quite a surprise. That could have something to do with it, but that they didn't seem to have ducks in order here.
We've been discussing this issue for some time, and I think that we should put forth what I call Phase 3. I think we should make it Phase 1, but that, of course, will have to involve Democratic counterparts, and I think the public should realize that the Democrats have to come to the table on this issue, because we need to reform the system.
All right. Congressman, thank you for taking the time.
Thank you very much.